Hello, everyone. Welcome back with you all about the nursing research lecture series. In today we are going to discuss Introduction to Nursing Research Part 2. In Part 1, we discussed the basic meaning of research, scientific research, and nursing research. In this second part, we are going to move one step further and understand research approaches and research methods. This is very important because before starting any research study, the researcher must decide how the study will be conducted. The way we conduct the study depends on the nature of the research problem. For an example, if we want to measure the level of knowledge among nurses, we may use a quantitative method. But if we want to understand the lived or lived experiences of nurses during night duty, we may use a qualitative method. Sometimes we may need both methods to get a deeper understanding. As the learning objectives, you would be able to understand research approaches. This means you should understand how researchers think and move from data to theory or from theory to data. Mainly, we discuss inductive, deductive, and mixed approaches. With this first lecture, I plan to discuss that part. In second, you would able to understand qualitative, quantitative, and mixed methods. These are the main methods used to collect and analyze research data. In simple words, this lesson helps you to understand whether your study should use numbers, words, or both. Research approaches. A researcher approach a research approach means the general direction or logic of the study. It explains how the researcher moves in the process of developing knowledge. There are three main approaches: inductive approach, deductive approach, mixed approach. The inductive approach usually starts with observations and it moves toward theory. The deductive approach starts with the theory and moves towards testing. The mixed approach combines both. In here, you can see a research approaches overview. The research approaches includes inductive method, deductive method, and mixed method. These approaches are commonly linked with research methods. Inductive approach is commonly connected with qualitative research. Deductive approach is commonly connected with quantitative research. Mixed method combines both qualitative and quantitative methods. However, we should not memorize this mechanically. The most important thing is to understand the logic. If the researcher starts with data and develops ideas, it is inductive. If the researcher starts with an existing idea or theory and tests it, it is deductive. If the researcher uses both exploratory and testing, it becomes mixed. The inductive approach means the researcher first collects data, then identifies patterns, and finally develops a theory or explanation. This is called a bottom up approach because the researcher begins with specific observations and gradually moves towards a broader explanation. In nursing, this approach is useful when we do not know how much about a phenomenon. For example, suppose a researcher wants to understand the experiences of newly appointed nurses in an intensive care unit. The researcher may first interview several new nurses. After listening to their experiences, the researcher may identify common patterns such as fear of making mistakes, difficulty adapting to the technology, lack of confidence, and need for senior support. From these patterns, the researcher may develop an explanation about how new nurses adapt to ICU practice. This is inductive because the researcher does not begin with a fixed theory. Instead, theory or understanding emerges from the data. Let's understand the example given in here. In the first example, the researcher interviews patients from the same area who reports the similar symptoms. After studying their responses, the researcher may suspect that an environmental factor is causing the problem. This means the researcher begins with the patient experiences and observations. Then the researcher identifies a pattern. Finally, the researcher develops a possible explanation. The deductive approach is the opposite direction of the inductive approach. Deductive approach means moving from a general theory to a specific hypothesis and then testing the hypothesis using data. This is called a top-down approach because it starts with a broad theory and moves towards to a specific testing. In nursing, deductive research is useful when previous theories or evidence already exist and the researcher wants to test whether they apply to a particular situation. For an example, there is a general theory that social support improves health outcomes. A nurse researcher may develop a specific hypothesis. Post-operative patients who receive family support will report lower anxiety than patients who receive less family support. Then the researcher collects data and tests this hypothesis statistically. A mixed approach means using both inductive and deductive approaches in one study. This approach is very useful when one method alone is not enough to understand the research problem. A mixed approach usually combines qualitative exploration, quantitative measurements, or testing. For an example, if a researcher wants to study medication adherence among children with asthma, the researcher may first conduct focus group discussion to explore the challenges faced by children and parents. This is inductive because the researcher is discover the ideas from participants. Then, based on these findings, the researcher may develop a questionnaire and test which factors are associated with medication adherence. This is deductive because the researcher tests findings using numerical data. So, as a summary, you can say that the deductive approach, how it is going on, and the inductive approach, how it is going on. So, with the next lecture, we will discuss the qualitative, quantitative, and mixed methods in deeply. Thank you very much for your kind attention. Stay continued.